Good morning, Teddy. Good morning, Theo. How you doing, Ty? Oh,
Hey Kevin, what brings you in today?
I woke up late for school and so I was sprinting to class and fell down and it really hurt on the inside of my leg. I think I got a pulled muscle or something.
Your right leg?
Yeah, the right side.
Alright, what I think happened is you strained your hip adductors. Let's do some range of motion and see how that goes. Alright Kevin, we're gonna do some passive range of motion. So you just relax, I'm gonna take your leg and go through some movements. Does that sound alright?
Yeah.
Start off going up. Alright, perfect, done.
Alright.
An adductor strain can be a tear or rupture of any of the adductor muscles, and this is usually caused by sprinting, rapid direction change, and movements of the lower extremity against resistance, which is why this is common in sports like soccer, football, and track. Although adductor strains may be random, they're usually caused by lack of warming up before an activity, not stretching enough, overstretching, and having a previous injury. The most common signs of an adductor strain are sharp pain in the belly or tendon of the affected muscle. Swelling may also occur but not necessarily be visible. Adductor strains can range from mild to severe, leading some patients to have only slight discomfort. And when assessing an adductor strain, always check for signs and symptoms of another problem such as a blood clot, hip pain, and SI joint pain, which can appear to refer to the groin area. The structures involved are all the adductor muscles of the thigh, as well as the pelvis, femur, and tibia that hold the origins and insertions of these muscles. It's crucial that the patient seeks treatment and avoids further damage by resting the inflamed muscle within the first 24 to 48 hours. Possible interventions include passive range of motion, initially followed by a gradual increase of exercise and resistance to strengthen and promote healing as the time progresses. Some other interventions include icing, compression, orthotics, kinesiology tape, and massage. Though some injuries are chronic, lasting anywhere from 3 weeks to 2 years, most injuries are acute and may heal and return to normal activities in 3 days to 3 weeks. It is essential for the patient to practice prevention and price to reduce the risk of initial injury, as well as additional injuries to the adductors. Price is protection, rest, ice, compression, and elevation. And prevention includes strengthening, stretching, and properly warming up the hip, thigh, leg, and abdomen.